Bhuvneshwari from GVF Fertility Center, Chennai. Today I am going to talk about PCOS and normal pregnancy. Is there a chance for normal pregnancy? That's a frequently asked question. So PCOS itself is an anovulatory condition. PCOD, polycystic ovarian disease, it means you will not ovulate spontaneously. You will have excess number of eggs and which are not ovulating on time. That is the meaning of the PCOS condition. But 10% of the patients can ovulate episodically in between or irregularly somewhere in the cycle they can ovulate, but we cannot predict or time the ovulation in that cycle. And PCOD, why is it coming? Because of the insulin resistance, obesity, our lifestyle, and also our diet abnormalities. And from the younger age, we are exposed to fast foods, toxins, and everywhere that pollutions and all those things causes this damage, and it goes into metabolic disorder. Metabolic disorder means your health is getting affected by all sorts of things, mainly insulin resistance. That is very common in PCOD. Along with that, you will have a diabetes, hypertension, pregnancy induced complications, preterm risk, and again low birth weight or big baby. All complications can occur with the PCOS. Again we come to the question, can I have a normal pregnancy? Can I deliver normally? All these questions are possible when you can do lifestyle modifications. I can walk for some time, at least half an hour a day, and that will definitely change your insulin resistance. If you can go back to our original proper dieting, which has got less carbohydrates and more protein and less sugar or nil sugar. This is kind of a diet is advised for any patients with PCOS, diabetes or any metabolic disorder. Again, your stress level. Stress level indirectly affects the hormonal pattern and it causes the hormonal change. Because of this basic internal change, you will exhibit your menstrual cycles will become irregular. Your face will have acne, hirsutism, that is excess hair growth, pimples, and skin discoloration will be there. Hoarseness of voice will be there. Your obesity will increase. Your overweight will become obesity, and other external features also will change. Only because of the reasons you will have excess androgens, that is male hormones will be high in your body. Second thing is you will be producing all testosterone, free testosterone, which causes excess hair growth all over the body. So this is the main reason you are going to have a both physical and metabolic changes. How can we reverse this? Definitely, if you think you can do it. So you can go for a fitness regimen, go for a walking, change your diet and lifestyle. It will reduce almost 50% of the PCOS. That's the only permanent cure. The second level is when it is very severe, very resistant, you can go for a medical or surgical treatment. And if your pregnancy is a concern, you can go for a ovulation induction. So why I am saying is it possible to have normal pregnancy? It is very difficult. PCOS will have difficulty in conceiving if they have a associated anovulation. So we have to go for a ovulation induction and then go for a pregnancy. And then it will become alright. Why again I am saying you have to be under monitoring when you are going for ovulation induction, because 50% of the time you will have a miscarriage risk. At least 2 to 3 times higher than the normal pregnancy. Pregnancy losses are noted in the PCOD patients because of the reasons they have a luteal defect and also hormone deficiency, progesterone deficiency. When you are under monitor, your progesterone can be monitored, your ovulation can be identified and timed so that we can start the progesterone support. Thereby we can reduce the pregnancy loss. That is the reason we say in PCOS, normal pregnancy possible provided your lifestyle is changed, your metabolic changes are coming under control, your insulin resistance is reduced, you still have a chances for normal ovulation and then normal pregnancy. At the same time, keep it under monitoring, and throughout the pregnancy also you need to have a proper checkup and antenatal care. Thank you.